The Black community in the United States faces several harsh realities rooted in systemic issues, historical oppression, and ongoing disparities. These realities impact economic opportunities, healthcare, education, criminal justice, and mental health. Below is a breakdown of some of the major challenges. 1. Economic disparities. Wealth gap. Black households have significantly lower median wealth compared to white households due to historical injustices such as slavery, Jim Crow laws, redlining, and employment discrimination. Employment discrimination. Black workers face higher unemployment rates and wage disparities, even when education levels are the same as white counterparts. Housing inequality. Black homeownership rates are lower, largely due to discriminatory practices like redlining, restrictive covenants, and biased lending policies. 2. Education inequality. Underfunded schools. Schools in predominantly black neighborhoods often receive less funding, leading to fewer resources, outdated materials, and overcrowded classrooms. Disciplinary disparities. Black students, especially boys, are disproportionately disciplined, suspended, or expelled, pushing many into the school-to-prison pipeline. College access and debt. While more black students are attending college, they often take on higher levels of student loan debt and struggle with repayment due to wage disparities. 3. Criminal justice system. Mass incarceration. The U.S. has disproportionately incarcerated black men and women at alarming rates due to systemic biases in policing, sentencing laws, and the war on drugs. Police brutality. Black individuals are more likely to experience excessive force, racial profiling, and unjust killings at the hands of law enforcement. Legal system disparities. Black defendants often receive harsher sentences than white counterparts for the same crimes, highlighting systemic racism in the justice system. 4. Healthcare disparities. Higher mortality rates. Black individuals suffer from higher rates of maternal mortality, heart disease, diabetes, and other preventable illnesses due to lack of access to quality healthcare. Medical racism. Many black patients report experiencing discrimination in healthcare settings, leading to misdiagnosis, inadequate treatment, or lack of pain management. Mental health stigma. While mental health issues are prevalent, stigma within the black community, combined with a lack of culturally competent therapists, prevents many from seeking help. 5. Mental health crisis. PTSD and trauma. Many black Americans experience racial trauma from systemic oppression, police violence, and generational poverty. Suicide rates. Suicide rates among black youth have been increasing, yet mental health services remain inaccessible or underutilized. Lack of black therapists. There is a shortage of black mental health professionals, making it difficult for many to find culturally competent care. National Mental Health Number. If you or someone you know is struggling with mental health, help is available. Call or text 988, the Suicide and Crisis Lifeline, which provides 24/7, free, and confidential support.